Assalamualaikum warahmatullahi wabarakatuh. Today, our group will be presenting our essay for IMR542 Records and Information Governance with title Strengthening Information Government Framework for Patient Data Protection Strategy Approach in Primary Healthcare Setting. Before we start, I would like to introduce our presenter for today, Muhammad Naim Najwa bin Muhammad Nizam, Aleeya Natasha Binti Khalid, Azwani Binti Zain Noordin, and myself, Nurussufi Binti Yaakub. For introduction, as we all know, primary healthcare is the foundation of health system, which is it delivering first contact and offering ongoing care to communities and patients. With growing use of electronic health records, EHR, and digital tools, vast amount of sensitive patient data are generated daily. While digital integration improves service delivery, it also raises critical concerns, which is it involves data privacy risks, security breaches, and also integrity and accuracy of information. Why is it matter of information governance? Information governance is a set of rules, policy, and procedure to ensure that health information is collected properly, stored securely, used ethically, and also disposed of appropriately by several different school of thought. According to Azadi 2019 and Edward 2016, they believe that information government in healthcare address key challenges, which is it is data fragmentations and poor retention practice, weak access control and system vulnerabilities, in, and also inconsistent data awareness and accountability. Information government also support that patient trust by promoting transparency and ensuring compliance with legal and ethical standards. As technology advances and patients become more aware of their rights, strong information government frameworks are crucial to balance innovation, compliance, and care quality. For methodology, as our research approach, we use document analysis. It is systematic review of written materials to understand information government in primary healthcare. Why do we use document analysis? According to Bowen 2009, it is suitable for complex system research. It is allow analysis of large, diverse data without direct interventions, and also identify trends, gaps, and best practice in governance. For our source review, we review academic journals and peer-reviewed articles, industry and regulation reports, and also credible online publications. Our focusing areas in our methodology is information government frameworks, legal and regulation compliance, data security technologies, and also implementation challenges in healthcare. For our key reference, this is several key reference that we use, which is Asadi 2019 in Information Government Evaluation in Healthcare, Nagisimani et al. 2022, which is Systematic Review of Information Practice. As our analysis method, systematic analysis to identify common issues and propose strategies for improvement.
Move to the next session, which is literature review. As here we have list a few information that we get from the many article, and one of it is defining information governance in healthcare by Ontario. Ontario said medical associate effective IG ensure that sensitive data like medical history or prescription are handled appropriately. Next, we have lead strategy leadership and organizational commitment, which is by Isaac 2016, frames that information governance as a strategic process that demand leadership from the top and engagement at all levels. In the healthcare context, this involves the active participation of hospital director, health IT managers and compliance officer, and also frontline staff. The effectiveness of IG relies not just on policy and system, but also on the shared commitment of all healthcare workers to handle the patient data responsibly. And next, we also have technological advance and smart healthcare system, which is by Masood 2018, that highlight the growing complexity of information governance due to the emergence of smart healthcare infrastructure, particularly sensor cloud system. This system enable the real-time diagnostics and remote patient monitoring by introduce new risks related to data ownership, transmission security, and also permission. Information governance must evolve to include more advanced encryption, secure communication protocol, and dynamic access control to preserve patient privacy. The next point is regulatory frameworks and legal harmonization. By Karisma and Yakanza 2022, they conduct a competitive analysis of data protection regulation in Indonesia, Singapore, and the European Union. Their study illustrates how fragmented legal frameworks can hinder the effectiveness of information governance, especially when patient data is managed by international vendors or transmitted across jurisdictions. Next is Patient Engagement and Trust by Rebound 2018 that says contribute a patient-centered viewpoint showing that public trust in digital healthcare system depends largely on privacy protection and transparency. Their findings suggest that information governance model incorporating OPT in consents opens in data usage and mechanism for patient engagement tend to achieve higher rates of adoption. And lastly is institutional gaps and framework deficiency, which is according to Mani 2022, the lack of formal information governance structure is a recurring challenge in many primary healthcare systems. Observe the institution often rely on partial or ad hoc models, leading to inconsistency in how policy are applied and enforced.
The integration of information governance has allowed the healthcare providers to improve their service delivery, enhance data management, and also increase their operational efficiency. However, this integration introduced to a lot of risks to the patient data management. Data exploitation has become a normal routine for cybercriminals to gain money. Therefore, the sensitive patient data become vulnerable to breaches. Besides that, large volume of data is generated daily, which overwhelms traditional data management systems to handle. This issue will affect the quality and eventually messing up the file compilation of the patient data management. The healthcare providers also encounters insufficient funding and resources that can threaten the effectiveness of information governance. This is because financial is the main source for the organization to adopt new technology and also improve their personnel skills. In case they are obligated to adopt EHR, electronic health records, into their organization. Besides, a poor administration of the records can hinder the maintenance of health information. This is usually due to poor retention and disposal of the records. Now, moving on to the challenges. There are four types of issues that can threaten the effectiveness of information governance in healthcare. The first one is data and privacy risk. This issue can be caused by two main factors, which is the employee itself or through the cyber attacks. For example, in 2022, during the COVID-19 pandemic, there were a case where two COVID patients' names and details were exposed on social media. This negligence and mishandling causes severe emotional distress to patients and eventually loses trust in the integrity of healthcare providers in maintaining confidentiality. While cyber attacks, the most common attack to the cyber while cyber attacks, the common attacks happen in healthcare is ransomware. Ransomware is a virus that locks access to the data in order to ask for a ransom to recover the files. The second issue is large volume of data. A massive volume of data requires a systematic system to ensure accurate classification and secure the storage for the files. However, this large volume of data can delay the diagnosis and slow the access of information. This issue may result in poor storage conditions. Eventually, outdated and full storage systems lead to loss of information and performance degradation. The third challenge is poor data retention and disposal. Since the information in healthcare is overloaded, the data disposal is very important to allow the new active records to fill in the storage. A poor information governance may originate from overdue data retention that has not been properly managed. This issue leads to a lot of complications such as wasting time, money, and labor due to inactive records occupying the space without proper procedures. It can also lead to premature disposal of active patient records, making the organization need to generate and start a new records for the existing patients. And the last challenge is resource constraints. Sufficient, insufficient funding can limit the ability of the healthcare provider to implement, monitor, and enforce data management policies. It eventually leads to failed development of proper information governance framework and delay the adoption of EHR, which is electronic health records.
First of all, let's talk about the first strategy, which is policy development and enforcement. This strategy is all about creating clear and specific rules for how we handle patient information from collection to deletion. Policies need to cover everything: who has access to the data, how long we store it, and what happens if have data breaches. To protect against cyber attacks or misuse, organizations need strong security tools like encryption, multi-factor authentications, and intrusion detection. When new digital tools like mobile health apps are introduced, policies should guide how these tools are used while still protecting patient privacy. They should also include privacy impact assessments, clear access controls, and ensure any third-party vendors meet strict security standards. And lastly, policies must assign responsibility whether to a chief information security officer, data protection officer, or compliance manager, and all staff should be trained on them regularly. So moving on, next is we have optimizing information storage and retrieval systems. Efficient data storage and fast access are vital for good decision making in healthcare. Unfortunately, outdated systems can slow things down or block access altogether. Cloud computing offers a great solution. It's flexible, scalable, and lets healthcare workers access important files securely from anywhere, perfect for distributed or remote teams. Cloud storage reduces delays, improves availability, and allows professionals to focus more on patient care instead of managing old school servers. It can handle large files like electronic health records and diagnostic images while keeping them secure and always accessible. Last but not least, the strategy is continuous training programs. Everyone from doctors and nurses to admin and IT staff must understand how to protect patient information. Panday and Al-Solami 2020 stressed that regular training helps ensure healthcare workers know their responsibilities and can apply security measures effectively. Most data breaches happen not because of the hackers, but because staff simply don't know better. Weak passwords, accidental sharing, or falling for phishing emails are all preventable with the right training. That's why education must be ongoing, practical, and easy to understand so that secure practices become a habit, not just a policy. So, to conclude all the strategies, strong information governance in healthcare depends on three things. First, clear and regularly updated policies. First, smart and secure storage solutions. And third, continuous training for all staffs. When these strategies are in place, patient information stays protected and the health.
In conclusion, this study highlights the critical roles of information governance in safeguarding patient data and maintaining trust within primary healthcare. As digital technologies like electronic health records, EHR, and cloud systems become widespread, challenges such as privacy breaches, inadequate policies, weak staff training, and inconsistent legal frameworks threaten data security and service quality. Strengthening information governance through clear policy, robust accountability, secure storage systems, continuous staff education, and greater patient engagement is essential. A well-structured and adaptable information governance framework ensures that primary healthcare remains safe, ethical, and patient-centered in an increasingly digital landscape. That's all from us. Thank you.